So what are we talking about today? Today's topic is recurrent pregnancy loss. Okay. So I guess let's start. And by the way, I've got some questions already. Please feel free to send in any questions as well. Recurrent pregnancy loss. Okay, so by definition, recurrent pregnancy loss is defined as having 3 miscarriages really in a row. And what I mean by that is if you have 2 miscarriages and you get pregnant a third time and have a baby, and you're starting over. Meaning, so if you have another miscarriage after the baby, we're not considering that to be recurrent pregnancy loss. It really is more about having 3 or more pregnancy losses, miscarriages in a row. And that, of course, includes chemical pregnancies. And I understand why we call them chemical pregnancies, but I want you guys to know that those are miscarriages. Those are real pregnancies. They're not fake pregnancies. They're not, oh, the test kit screwed up and it's just a chemical. No, there was a baby there. You were pregnant. That was real. So you have every right to mourn that when that happens. So that's theoretically the definition of recurrent pregnancy loss. Okay, does that make sense? I hope. 3 miscarriages generally in a row. Lots of women. I mean, I've had 1 miscarriage, and that's with having PCOS and having a real tough time getting pregnant. And I had a miscarriage. So a lot of women have had miscarriages. They're really common, and probably, honestly, unlike you guys who are looking to conceive and know exactly what's going on with your body, you're all well aware of when you have a chemical pregnancy or miscarriage. But the rest of the population that either aren't trying or aren't paying attention to their bodies and if they're really late or not, or when they ovulated, that group of people, that huge amount of the population is certainly getting pregnant as well and just not aware of it. Maybe their period is just, they're not doing any of these tests or temperature taking or any of that, and their period is 2 or 3 days late. It shows up. Of course, we just chalk that up to stress or what have you. But the truth is they very well could have implanted, and many of them have gotten pregnant and just didn't even realize it because they just have a period like normal. So that's why I said miscarriages are certainly a lot more prevalent than we think. Okay. So now we've discussed what recurrent pregnancy loss is. Let's talk about what causes miscarriages at all, really. And again, we've already defined what makes it recurrent. Okay, so pregnancy loss happens for 1 of 2 reasons. I'm just going to say it like it is easy to understand, but it's either your fault or it's the embryo's fault, right? I had a consult with a gal today who had 2 miscarriages and she'd had a D&C with 1 of them. And I'd asked her when she had the D&C if they did karyotyping on what they call, and I really hate this phrase, but products of conception, the baby. So they'll do what's called a karyotyping. And what that tells you when you have a D&C done is that'll tell you if the embryo was the one at fault, if it was an abnormal embryo. So for example, if a gal had 3 miscarriages in a row and she did, karyotyping on every one of them and found out that each time it was the embryo's fault, I don't even really qualify her, so to speak, as recurrent pregnancy loss. Recurrent pregnancy loss is really almost a diagnosis. Now, take a 42-year-old, God love her, who's been trying to get pregnant, and she is absolutely going to have more miscarriages than somebody who's 32. But we know why. She has older age. She's much more likely to have a miscarriage. So even though she might have 3 miscarriages, as long as we learn, from the karyotyping on the embryos that they were abnormal, then that's not her fault. This is just a game of chance sometimes. So if you do have a miscarriage and your doctor's doing a D&C anyway, then talk to them about doing karyotyping on the products of conception, because you'll learn why the miscarriage happened. Sometimes now, in the case where the karyotyping comes back normal, and if that were to happen, 3 or more times in a row, where again, now it's your body's fault, so to speak, then we know we've got to start looking into that. Now we've got a true diagnosis of recurrent pregnancy loss. Does that make sense? Okay. So a miscarriage happens because it's either the embryo or it's your body. Most often it is the embryo. We know most of our eggs are abnormal. Even egg donors, I would have to tell my clients, expect that half of that egg donor's eggs will be abnormal. So imagine if you're 37 and you're not 27 anymore, you're even going to have more abnormal. Now, most often you're not even going to fertilize those eggs. And those eggs aren't even, resulting embryos rather, aren't even going to implant. You're just not going to get pregnant. But sometimes you get pregnant for a minute. Your period is a day or two late. Sometimes you get pregnant, you stay pregnant till you're 8 or 10 weeks along, and then you have a miscarriage. Those are the times, like when I had my miscarriage at 10 weeks, and mine was a missed abortion, they called it, because I didn't know. It wasn't, nothing was coming out, so they did a D&C. Those are examples. I don't promote D&Cs. I mean, D&Cs aren't something you should have unless the doctor's recommending it. You don't do it just to get the karyotyping. I mean, because you just don't want to do these procedures on your uterus just because. So that's why we're going to miscarry. So again, if it's the embryo's responsibility, then there's really nothing to talk about or do, because that leads to a question which was on my list that came to me, which was, what can we do to improve the egg quality so we don't miscarry? And I've said this before, and this, of course, is my opinion, but I feel strongly about this. You really can't change egg quality. The reason our egg quality is an issue generally is due to age. And as soon as one of you guys figure out how I can not be growing gray hair and how my knee will stop hurting and all of the other things that come with, and my memory. As soon as you figure out how to resolve those age issues, then we can resolve the issue of older eggs and change the quality. Those eggs are there and they've been there since you were born. So they are as old as however old you are. And we know what age does to things. So how can I change that? I mean, certainly, do I know that, what if you give the advice at least to let people be healthy, eat healthy, get that exercise you're supposed to get, take good vitamins and supplements, get the antioxidants, CoQ10, all that kind of good stuff. Certainly that cannot hurt. I mean, I take those supplements and I do those, well, not so much the exercise thing, but we're all trying to stay healthy, right? We're all trying to be better at that. So do I know that that doesn't help egg quality? No, I don't. But I can tell you from, lots and lots of experience that I have not seen in all of my 20 plus years some kind of significant number of people come along in a group of women over 40 who tell me they stopped eating red meat and all they drink is green tea and they have eggs of a 25-year-old, or maybe they did acupuncture and that changed their egg quality. The thing is somebody's going to do acupuncture and the acupuncturist is going to promise them it changes their egg quality. And you know what? They're going to get pregnant, just like I got pregnant at 45. I did nothing. I don't know, probably had a bottle of wine that night. That was about it. So I didn't do anything special. But if I had, it would be really easy to tie that kind of, 1 in 100 chance to that activity. And that's often what people do. But the reality is and this is the problem on social media, right, is when that one gal gets on there at 42 and just boasts about how she did so much acupuncture and her egg quality changed. There are 99 other women who did the same acupuncture and nothing happened. You know what? They're not really on posting all about how they failed. I get it. I would do the same thing, I'm sure. But what that does is that skews the information that you get out there. Now it seems that, now again, take, I got a dozen of those women who were lucky. And I got 500 that worked. But those 12 that are posting, I really get the impression that everybody who does acupuncture is getting better egg quality. But me, of course, it's just me. I'm failing as usual. So I don't like that message at all. And I want you to be aware of that happening. Okay, that's the downfall of social media. It is a selective population that posts. Understandably, nobody wants to post and say, yeah, no, I didn't get pregnant. Yeah, no, I didn't this. But of course, the gals who are getting pregnant easy at 42 with acupuncture, sworn to increase their egg quality, they're posting. So it seems like it happens. But the reality is there's really not a lot. So I don't want you to stress about that. And most important, I don't want you to feel like you have control over that. And therefore, you're responsible for your egg quality or lack of egg quality or what have you. That stress you put on yourself probably worries me more than anything. So short answer is, I'm not a big believer in there's something you could do to change your egg quality, except pretty much accept it. Now, remember, it doesn't mean when we talk about egg quality. And of course, this ties to recurrent pregnancy loss because that's what most miscarriages are from. When it comes to egg quality, your eggs are perfectly normal in you right now. I don't care if you're 48 years old, your eggs are normal. It's just that when they have to go through that process of meiosis, where they divide their chromosomes in half, which happens right before ovulation, they fail miserably at that. That's not an easy job to do, and so they don't do it well. Sperm has no problem doing it because sperm are only 2 or 3 months old. So they do it, no problem. So men can have babies as they get older. We can't. So our eggs aren't abnormal sitting here right now because you're chromosomally normal. So therefore your eggs are chromosomally normal. It's just when they have to undertake that action that they become abnormal. Okay, what else? Other questions that I received. How can I prevent recurrent pregnancy loss? Well, that depends on what the reason behind it is, right? Which sometimes we learn and sometimes we don't. But let's just say you are a young gal, you're 28 and you've had 3 or 4 miscarriages in a row. That diagnosis is recurrent pregnancy loss, because I don't expect that to be about egg quality. I mean, it could, I'll never know. But generally, or certainly if gals have done those D&Cs and gotten the karyotyping and they find out that they keep having normal, pregnancies lost, this is recurrent pregnancy loss. So how can I prevent recurrent pregnancy loss? Let's talk about what causes, or rather, what can we do to help prevent it, right? Well, again, if it's that egg issue, then there's really nothing we can do. But what about that 28-year-old who's had multiple miscarriages? Diagnosing it is tricky. There are different reasons why you could be losing pregnancies in a recurrent fashion. Okay, what if there's something physically wrong with your uterus? Okay, like what? Like maybe you have an anomaly with your uterus. Do you have a septum inside your uterus? Do you have an abnormally shaped uterus? I don't mean position. That would be retroverted and anteverted and all that. Not that, but like you have a bicornuate uterus or something that you were born with, an abnormality to your uterus you were born with. Which these are not common at all. But these are reasons for a physical uterus that they might lose pregnancies. Yeah. You could have other hormonal issues like thyroid problems. Of course, thyroid problems are known, if they're not under control, to cause miscarriages as well. That's why doctors usually are always checking out your thyroid when you're trying to get pregnant. Other reasons for recurrent pregnancy loss are clotting issues. Your doc may have done blood work on you with tests like MTHFR factor V Leiden, or just blood tests, take about a week to get results on. And these blood tests could talk about if you have clotting issues. That could. Now, and by the way, I'm starting to get into areas that not every doc and not everybody believes in, so to speak. Large group that does, but not everybody does. But clotting issues is a philosophy out there. And that's when you hear about women when they're pregnant and they're put on heparin, or they're put on baby aspirin for those reasons. Another reason for recurrent pregnancy loss is thought to be autoimmune in nature. So autoimmune in nature, what does that mean? Well, again, there are, fancy blood tests that can speak to whether or not this could be concerned. And I'll tell you right now, if you go see your reproductive endocrinologist, the kind of doctors that help women, with these issues to try to get pregnant, you're going to find some will tell you this is a bunch of malarkey, a bunch of BS. Others really believe in it and subscribe to it. I worked for a doctor for, like I say, over 20 years, and he was a big believer in it. As a matter of fact, he was kind of considered the grandfather of immunology. So he very much believed in this. And I will tell you, from all of my years of experience, after watching, that 28-year-old gal who lived in, I don't know, I'm here in Vegas, and she lived, I don't know, in Texas or something. And she tried to get pregnant, and she did get pregnant. She miscarried, and maybe she did IVFs even and got pregnant with those and miscarried again. And everybody said her embryos looked beautiful. They couldn't figure it out. She kept getting pregnant with them, and she just kept losing them. And lo and behold, she comes over to our clinic, and we do good embryology, but no different than anybody else. But what our doc does is he looks into autoimmune reasons, and he provides her treatment. And lo and behold, she gets pregnant. More important, she stays pregnant. I have seen these women so many times, and it's a good control. I mean, I'm using her as a control against the old her. That's why it's so hard to do studies in infertility or any of that, because women vary so much. But when I've got a gal I'm using her as her own control, and I see that multiple times, that tells me there's something to that. So blood work like antiphospholipid antibodies, blood work like natural killer cell activity, where, like we're learning a lot about the immune system nowadays, right? We're learning that there's so many things that tie back into your gut health and your autoimmune status, and we just now, they're starting to believe asthma and just all kinds of things are autoimmune in nature. In other words, your body is attacking itself. It's overzealous, right? It goes overboard. And sometimes it might not want that embryo. I mean, come on, the embryo is half your partner. So is it a foreigner to you? Well, yeah, of course it is. But of course, our body knows what to do to prevent that, but not if you've got this, linebacker immune system that might get rid of it. So that's what the doc I worked for did, a lot of that kind of testing. And I did become a believer in it as well. And treatment was, again, could be heparin or Lovenox injections, could be baby aspirin, or it could be what's called an intralipid infusion. That's an IV infusion. It takes about an hour to do. It's a man-made lipoprotein. So would be, but again, this is now you're getting into people who are doing IVF and in vitro fertilizations and that kind of thing. And generally, it's hard to do expensive treatment for recurrent pregnancy loss if you're not doing something like IVF to boost your odds to begin with. I mean, nobody wants to pay for anything, but nobody certainly wants to pay, $1,000 a month while they try at home and have a 20% chance of getting pregnant every month and paying $1,000 every month, kind of thing, or more than that once you get pregnant. So that's why usually immune treatment is tied to some kind of in vitro fertilization treatment as well. All right, let's see. Any other questions we had before I let you go? I think that's about it. I think those were the list of questions I had. I think I hit on all the topics I wanted. So listen, Premom community, come on over. We have an Ask an Expert area where you can post questions. I answer there all the time. You're going to get answers from me. And also virtual consults. You are welcome to schedule a virtual consult. We have a whole panel of experts. Pick who works with you best. I'm there as well. I'd love to talk to you. And I have regular people who do that. They come back regularly, even if it's just for therapy or just to chat, because this drives you insane. So sometimes you need somebody to talk to. Right? So please always feel comfortable to do that. The Premom community, that Premom, we are there for you. You are not alone when you have Premom. You remember that. Okay. I'll see you guys later. I'll see you over in the communities. And I look forward to chatting with you guys again soon. Have a great night. Bye.